Hello, and welcome to another live broadcast with MedStar Health. My name is Karen Single. I'm live today with Amanda Joy, Physician Assistant and Associate Medical Director of MedStar Health Urgent Care. Nearly everyone is familiar with strep throat. I certainly am. I've had it several times. And when it's really painful to swallow, you just feel under the weather, you have a bit of a fever, and those dreaded white spots. What do you do? Diagnosis of strep throat can really begin to climb when it's colder outside, which it's starting to get, and this year is no exception. Do you really know all the facts about strep throat? Well, that's why we're here today to inform you. And I want to thank Amanda for being here today with us. Amanda, welcome.
Thank you very much.
And I know you're well acquainted with the symptoms and treatment of strep throat in all ages. And we're looking forward to hearing more from you. Before we do, why don't you tell our viewers a little bit about yourself?
Well, I am a physician assistant and I have been working within the MedStar system now for over 20 years. I initially started out working in the emergency departments within MedStar, and about 7 years ago, I transitioned over to work mainly in the urgent cares. I occasionally still pick up a ER shift here and there, but work primarily in the urgent cares. And it's been a wonderful transition. And really, urgent care has become one of the best front doors to MedStar. So we get to have a lot of contact with a lot of different types of patients. And it's always very rewarding getting them where they need to go to get the right care they need.
All right, that's wonderful. Yes, I also go to urgent care too frequently, probably.
Yeah,
Having kids, of course, always gets you there perhaps more often. But let's jump into our questions. And thank you to our viewers. Thank you for tuning in and watching. If you have any questions for Amanda, please post them in the comments. And also remember to give us a like. Let us know you're watching and share this post with your friends and family. We want to spread the word, not strep throat. Let's
absolutely not.
start with what is it? Can you talk to us about what is a strep throat infection? Let's start there with the basics.
Sure. Strep throat is a bacterial infection. It's the group A strep pyogenes bacteria, and it's actually the most common cause of sore throat in children and adults. The only known like reservoirs where we have strep kind of lingering around us are actually in your mucous membranes, or on your skin. So it's not like you can pick it up from other places. We actually harbor the bacteria and spread it around.
Well, interesting. Thank you so much. Do only children get strep or do adults too? And are symptoms worse in one or the other?
Great question. So, group A strep is, like I said, the most common cause of bacterial throat infection in children and adults, though it's less common
Cause
in
of
children.
bacteria.
I'm getting echo. Children under the age of 3, we do see it, and it accounts for about 15 to 30% of sore throats in kids between 5 and 15 years of age. And in adults, it's about 5 to 15% of causes of sore throat. I think it's probably equally symptomatic. I think as adults, we tend to not tolerate any sickness very well, so it can seem much worse, or we could feel like it's much worse. I think it's typically difficult too in younger children because they can't tell us what's bothering them. It's harder to determine, do they have a sore throat? They don't even, in some cases, 1 and 2 year olds don't even know what their throat necessarily is. So it's hard for them to articulate. So I think it's harder in cases where you can't really identify what's going on, and in adults that just don't tolerate illness very well.
Yeah, it makes sense. I know when anytime my kid gets sick, it's like, am I gonna have to get tested for strep? I
The
know.
dreaded throat swab.
Yeah, so they're like, oh, they might not even want to tell you, right? They might, but let's talk
That's
about
so true.
those symptoms. Of course, your throat hurts. But can you talk about, yeah, what are you feeling in your throat? And do people always get those white spots?
Great question too. So strep usually is abrupt onset. So you're fine one day, the next day you're sick. And it comes with often a fever, a lot of headache, and sore throat. So those are the main symptoms that we will see. But that white spots that you're talking about, we call them exudates, and those are actually pretty common. You don't have to have them, but they're actually an indicator of the body's immune response to that bacteria. So you're actually seeing your body trying to fight that infection if you have those white spots.
Okay, cool. I didn't know that. Um, are there other symptoms that are less usual that people should still be on the lookout for?
In kids, particularly, we see a lot of kids come in with abdominal pain, nausea, vomiting, they're not wanting to eat. Those are pretty common in kids, less so in adults. Some other things you can see are on the hard palate or roof of the mouth. You can see these like red little they're flat. You can't feel them, but they are like blood burst blood vessels on the palate. Sometimes your uvula, or as my kids call it, the punching bag that's in the
Mhm.
back of your throat, can get big and inflamed. Or you could have a rash. When we get the rash with strep, we call that scarlet fever. And that's typically a rash that's like little fine bumps, often called like a sandpapery type rash. It feels like sandpaper when you rub your hands all over it. And it will start towards the groin and in the armpits and then spread across the trunk and then down the arms.
Hmm, okay. Or the hanging ball. That's what I call the hanging ball.
I like the punching bag. That
I
that
like the
always
punching bag. I
that's
haven't heard that one. That's a good one.
always my
Um,
favorite.
yeah. Well, how quickly does strep develop, and when is it time to get tested, get that wonderful throat swab?
It's actually pretty quick. So
Oh.
the typical like incubation period from when you were exposed to actually starting with symptoms is only between like 2 and 5 days.
Hmm.
So, you're sitting next to a child in school that is starting to have symptoms and they are gone the next day. Well, you're probably going to be out the day after that. It happens pretty quickly. Um, you Sometimes if you're exposed, you might not show any symptoms at all. Um, and those folks are often what we call carriers. So you can carry strep, but you may not exhibit any symptoms. In a healthy person, we don't really worry about that too much. We're not looking for strep carriers. We're not treating them with antibiotics. We're really just treating those who have acute symptoms and that have a positive strep test, or we have a strong suspicion for strep, looking
Mhm.
for those other things like those little burst blood vessels on the roof of the mouth or swollen glands. Those sort of things can tip us off to it being more likely to be bacterial versus viral, which is the majority of the other infections that we see.
Mhm. Makes sense. Well, thank you very much. I'm going to pause just for a moment to welcome our viewers and thanks for joining us today. We are talking all about strep throat with Amanda Joy, and we're looking forward to hearing your questions. If you have any, please post them in the comments. We've talked about symptoms, we've talked about when to see a healthcare provider. We have more to discuss. So if you haven't already, give us a like and share this broadcast with your friends. Let us know you're watching. So you mentioned carriers and the fact that yeah, there's could be you could have strep throat without symptoms. But what about when you do have symptoms? And can you talk about the contagious factor of strep throat? How contagious is it, and how long are you contagious? And how can you be mindful of what to do to help stop the spread of strep throat?
Well, as I mentioned earlier, like the bacteria is present really in those mucous membranes and on your skin. And so you can transmit strep through direct contact, or you can spread it through like respiratory droplets. So as you sneeze or cough or even talk, those droplets are coming through that area of those mucous membranes, and it can put those droplets out into the air. And so, unfortunately, if you're in a space where someone who had strep is coughing, sneezing, or talking, you may then get that bacteria. So, we would call it very contagious, just because it is really easily spread.
Mm-hmm.
Um, I would say that you are not contagious anymore after you've been on antibiotics for about 24 hours or so. We would recommend, of course, you stay home from work until you don't have a fever anymore and you're starting to feel better. But truly, 24 hours of antibiotics, you should be clear to return.
Okay, not too bad. Um, can people still get strep throat even if they don't have tonsils?
Yes. So,
Okay.
strep throat is actually an infection of the throat and the tonsils if you have them. So, it's not just for those who have tonsils. When you do have tonsils, you may be at more of a risk for some of the complications like peritonsillar abscesses that you wouldn't see in someone who doesn't have a tonsil anymore. So, I think it's important still to get evaluated if you're having symptoms, even if you don't have those tonsils any longer.
Mm-hmm. Okay. And I've heard this has been some time. I don't even know if this is done anymore, but do you ever get questions? Well, should I just not? Yeah, I guess if you could still get strep throat even without tonsils, but they don't take tonsils out anymore for strep throat, do they? Is that, well,
Uh,
thank
Not really.
Okay.
Um,
Yeah.
for the average patient, and we get this all the time, like mom will ask, this is her fifth bout of strep this year. How many does she have to qualify to get her
Mhm.
tonsils out? That's really not a thing anymore.
Yeah.
If you're having other issues with your tonsils, they're swollen, causing you to snore or have sleep apnea or trouble breathing, then of course we would look to have those removed. If it's just a frequency of infections, that no longer really is an indication to have a tonsillectomy.
Hmm. Okay. Thank you for that. Yeah, that's helpful. I've heard that before. Um, okay, so you're having symptoms, you're contagious, you want to get on those antibiotics so you can get back to work, start feeling better, hopefully within that 24, 48-hour period. We talked earlier about when to see a provider. So you're at that point, you're looking for an urgent care so you can be seen perhaps the same day or within a few hours. So how quickly can a patient find out if they have a positive or negative strep infection once they come into urgent care for testing? Does that get done at urgent care at the site? And how long does that typically take?
Well, not all urgent cares and their ability to test are created equally. Many of the urgent cares out there, and I would say the vast majority, actually use a rapid antigen test. So it's looking more for the body's immune response to strep as opposed to the strep itself. When you have those antigen tests, that can only be sensitive somewhere between 70 and 90%. So you'll find that many of the different urgent cares would then send out a throat culture if your rapid test was negative, just because there's a 30% chance you could still have strep throat. That can take up to 48 hours to come back, sometimes even longer on weekends or holidays. And then we want to have you treated as soon as possible for strep because we know we can get you better quicker,
Mhm.
and we don't want to have to deal with any of those complications. So the throat culture and the delay in that can be problematic.
Hmm.
We are very, very fortunate at MedStar. We have a rapid PCR test for strep, and it's wonderful. The manufacturer quotes a sensitivity of 99.4%, so super duper accurate. Probably as high as throat cultures are. And so that PCR test is actually looking for that DNA, RNA in the virus itself, as opposed to the immune response to it.
Hmm.
Our rapid PCR tests at MedStar Urgent Care only take up to 18 minutes to result, so they're
Wow.
very quick. The if it's overtly positive, sometimes you can get the results back in like 5 or 10 minutes.
Hmm.
But the longest it would run would be about 18 minutes. So you get the results same day. So at MedStar, we rarely send out throat cultures anymore because we just don't need them. We have such a very sensitive test in urgent care, and that has actually helped us get the patients the right treatment sooner than we were able to when we just had antigen tests. So if you're looking for an urgent care to get a strep test, I would highly recommend looking for an urgent care that can do a PCR based test because you get the right answer much sooner.
All right, thank you. That's great that we have that at MedStar Health. So let's talk about treatment. So you've tested positive. What does the treatment look like? Are antibiotics always required for a strep infection?
We discussed a little earlier, if you don't have symptoms, you don't necessarily need to have any treatment. The one caveat to that is if your whole household is infected, it may be worthwhile go ahead and treat everyone in the household so that you're not getting people reinfected. But for the most part, if you are just a carrier of strep and you don't have any symptoms, we don't need to treat you. But most of the patients that we're seeing are coming in with acute symptoms. And for them, antibiotics is definitely the way to go. Um, when you take an antibiotic, you typically resolve your symptoms in about 3 to 5 days. Now, like I said, you're not contagious anymore after about 24 hours on antibiotics, but you could still have some symptoms for about 3 to 5 days on those antibiotics. The typical duration of therapy for strep throat is actually a 10-day course of antibiotics. And a lot of parents are like, oh, 10 days of trying to give my child this liquid medicine is just painful.
Yep. Know how that
But
is.
it's actually important because when you treat for the full 10 days, it has been shown to enhance the eradication of that bacteria from your throat when you compare it to just treating with 5 to 7 days. So, if you were to treat with these shorter periods, you may get more recurrent infections. And then, on top of that, treating with 10-day courses seems to really reduce some of the complications that we can see from strep. So it's, I think, important to take the full course of treatment. You want to treat for those 10 days. And the most typical antibiotics that we use are penicillin or amoxicillin. And I believe amoxicillin comes in the bubblegum flavor that everybody liked as a child. So typically our kids will tolerate that. If you've got an allergy to penicillin products, we can look at other antibiotics. Some of them may not have the same effect or ability to treat strep as our penicillin and amoxicillin, but for the vast majority of patients, they work just fine.
All right, thank you very much. What about what happens if strep goes untreated?
So some of the complications you can get are many. You can get an abscess. And so when we look into your throat, one of the things we're looking for is your little punching bag. Is it hanging in the middle where it should be? If you're having a severe sore throat, or your muffled voice, or you're drooling, those are concerning. And you look in your throat and that punching bag is off to the side, that's concerning to us that you're developing an abscess. So that would be something that we would want you to get emergently evaluated. You can also get ear infections, sinus infections. Very rarely you could get a meningitis um, or a sepsis situation from strep throat, but again, that is very uncommon. Some of the kind of more unusual things that you can see. You can actually develop rheumatic fever. You can get a kidney injury or inflammation of your kidney from it. Or you can even get some arthritic changes from having strep. So when I look at like rheumatic fever, what is that, right? So that is usually about 2 or 3, maybe up to 4 weeks after a strep infection. The patient starts to develop chest pain, shortness of breath. They may get a rash. This is indicative of damage to the valves in the heart. So if that's not noticed and treated right away, you can get some significant cardiac damage from having rheumatic fever. And in those patients that have previously had rheumatic fever, we're super cautious and we make sure they get antibiotics right away, even for future infections, because we want to protect those valves.
Mm.
When we're talking about the kidney injuries, so that can come after a infection as well. And the symptoms that you may see with that are like a brown colored urine, blood in the urine. You can get swelling. You could have a high blood pressure. If you're seeing any of those things, it would be very important, particularly the urine changes are what you're going to notice first. We want you to get evaluated immediately. Sometimes you have already recovered from that strep, thinking it was just something viral, but it actually wasn't. And now you're having these downstream effects related to that.
Mm.
The last thing that we see is that arthritis. And so usually that can be a couple of days to a couple of weeks after you've had a strep infection. It can be one specific joint or it can be multiple joints. Typically, we see it more in the lower extremities, like your knees or your hips, but we can see it in the upper extremities as well. So if you're having a kid who recently was ill and is now limping, that's concerning to us, and we want to take a look at that child right away.
Okay, very good to know. Thank you. Because, yeah, it's not like a viral infection where you just kind of, let it ride, right? You got to take care of it. So, as you're dealing with symptoms at home, perhaps, what are some remedies that you would recommend to our viewers? I'm guessing popsicles would be one.
Absolutely, adults or children,
Yeah.
popsicles, and particularly we like the Pedialyte popsicles or even the generic version of that, of course, something to get the electrolytes in as well. Anything you can do to get liquids into your children when they're having a sore throat is the way to go. If they want juice, they want milk, that whatever is able to get the hydration into them, we want to use. Of course, it's always best to switch to water and electrolyte based drinks when possible. But if you find something in the very early phases that you can get them to drink, I think it's worth just go ahead and giving them the liquids to keep them
Mhm.
hydrated. I know there's a lot of controversy about using Tylenol right now, but we would recommend the use of Tylenol or Motrin just for the fever control, pain control.
Mhm.
Humidifiers are great. When you have big swollen tonsils, you tend to snore and breathe through your mouth. So all your mucous membranes get dried out. So humidifiers up in your bedroom are wonderful to use. Um, and then I would just say hand hygiene is important as well. So if you're at home and your family members are around you, prevention is key, and good hand washing, especially after coughing or sneezing, is also super duper important to do at home.
Yeah, all great tips. Thank you so much. I think we talked about this a little bit, but so now that we've talked about the symptoms and treatment and home remedies, can you share again with our viewers how long would they expect to be sick for if they had strep throat or get strep throat? And then let's remind our viewers about the contagious, how long you're contagious for before we
Sure.
wrap up.
So most patients can return to work or school after completing one full day of antibiotic treatment or 24 hours. Depending on what antibiotic you're on, it's usually 2 doses. Um, but if they are then not having a fever and are feeling improved, they would be able to go back. They're no longer contagious. When you're on antibiotics, typically your symptoms resolve somewhere between 3 and 5 days on those antibiotics.
All right. Thank you so much. That's all the questions that I have. Is there anything else you want to make sure we mention about strep throat or anything that you wanted to reiterate or a key takeaway for our viewers who watch today?
I would just keep an eye out for the more severe symptoms, the drooling. We like to call it like a hot potato voice. It sounds like you got a big hot potato back in your throat. If their patient is having trouble breathing or sitting forward in a tripoding position, if the fevers are persisting, even though they were on antibiotics, or they're getting neck stiffness, those are all things that could be these complications that we are more worried about. So don't just chalk it up to, oh, it's just strep, it'll get better. If you're having these unusual symptoms, those are reasons to seek immediate medical attention because a lot of times we can prevent the cardiac valve damage and the kidney damage if we can get treated much earlier.
Yeah. All right. Well, that is a great takeaway. Certainly something that I never thought of. When I think about strep throat, I just think about fever and sore throat and nothing else outside of that, even, with or without treatment. So really great tips and insights. Thank you so much for being with us today. And thank you to our viewers for watching. Of course, if you are looking for services for urgent care, we also have primary care that can help treat your strep throat symptoms. We encourage you to schedule an appointment. We'll post a link in the comments. Thank you so much, Amanda, for being here today. Really appreciate it.
Thanks for having me.
Yeah. All right, everyone, we'll see you next time. Have a great day. Bye bye.